and the next day you are paying the whole load for childcare with nothing in between. And I was very excited to see the law. And then I said, there's no mention of money. Wait a minute, where's the money? And of course the answer was, not so much. But we were also very lucky to be able to pull together the rules that came out in September to make everything very, very clear. And so we know that states across the country are working on coming into compliance with these, with the law and the rules. And everything that we can give you in regards to extra information and extra technical assistance, we certainly want to be able to do. And so this afternoon or morning, if you're in the Pacific, we have the privilege of hearing from not only one of our own, Min Lee, who is one of the experts in the OCC regarding subsidy eligibility, but from two of the states that have really gotten it pulled together and, of course, are still working to get it further together. So I'm looking forward to all three, and I will turn it over to Min.
Okay, thank you very much, Ellen. Good afternoon, everyone. As Ellen mentioned, my name is Min Lee, and I'm happy to have you join us today to talk more about subsidy eligibility policy. I'm glad that Ellen characterized it as the rule making everything crystal clear, but I know that there are a lot of questions, so I'm here to try to make it even more so. So I'm going to give a brief federal presentation and then hand it over to the states. I think there's a lot of value in hearing about their experiences, so I'm going to zip through a lot of the basics that we have around the rule, and then we have explanation of graduate phase out, which I know that people have a lot of questions on, and then some Q&As that we are going to address. So quickly, as you know, in 2014, Congress reauthorized CCDBG, so I'm not going to dwell on that. As far as compliance dates, just for you as a reminder, since a lot of you have already submitted your plans, that anything that's new to the rule that wasn't in the statute, you have until September 30th, 2018 to come into full compliance, and compliance will be determined through CCDF plans and federal monitoring. And as per tribes, things would not become effective until October 1st of 2019. So these are the overview of the four major topical areas in the rule. We're focusing today on providing equal access to stable, high-quality childcare for low-income children, specifically on subsidy eligibility. So here, as Trisha said, eventually these slides will be made available. So just for your reference, these are some of the key regulatory references. If you, like me, travel everywhere with the copy of the final rule with you, you want to look at 98.20, eligibility for services, and 98.21, eligibility determination process.
I think we've got somebody who is doing some typing in the background. If whoever that is wouldn't mind putting themselves on mute, that would be great.
So I do appreciate you taking very detailed notes on while you're listening. So the presentation today, we're going to focus mainly on the lengthened eligibility and continuity, continued assistance / job search, graduate phase out, and application to tribes. So as you know, the law established minimum 12-month eligibility periods, and this is regardless of a temporary change in parent status as working or attending job training or education, if the family's income does not exceed 85% of SMI. Some things that the final rule clarified is that the minimum 12-month eligibility applies at initial and subsequent eligibility periods. It prohibits shorter authorization periods within the minimum 12-month eligibility period, and clarifies that co-payments cannot be raised during the eligibility period. At 98.21a, we further define temporary, which is statutory language, to mean at a minimum any time-limited absence from work for an employed parent due to reasons such as need to care for a family member or illness, any interruption in work for a seasonal worker who is not working between regular industry work seasons, any student holiday or break for a parent participating in training or education, and any other cessation of work or attendance at a training or education program that does not exceed 3 months, or if the lead agency wants to extend that a longer period of time. As Ellen said, a lot of these changes were made just to try to make it a little bit easier for families to stay on and have the stability that they need as they're working. So a few other things that we clarified in the rule is that a child should retain their eligibility even if they have a change in age during the eligibility period, including if you turn 13 years old, and that any change in residency within the state, territory, or tribal service area, the child should also retain their eligibility. We did, however, during the public comment period, ask for comments on areas where the lead agency should be able to terminate assistance during the year. So after looking at everyone's comments, we did add these three pieces. So lead agency may discontinue. We emphasize may. This is at the state option. Assistance in these limited circumstances for excessive unexplained absences and after attempts to contact the family. A change in residency outside of the state, territory, or tribal service area, and substantiated fraud or intentional program violation. And just to note that these three are in addition to the option to end assistance for a loss of job or cessation of education or training. So, as you know, continuity is a big piece of what the reauthorization was aiming to do. So, at eligibility determination and redetermination, information needed to determine eligibility includes child age, family income, qualifying activity, or other information as determined by the lead agency. What the rule does is we're limiting reporting requirements to changes that impact the child's federal eligibility, such as their income goes over 85%, which families must report. Information that impacts the lead agency's ability to communicate with the parent or provider. Lead agencies must not require an office visit in order to fulfill these notification requirements, and must offer a range of notification options, for example, phone, email, and extended hours. As far as reporting during the eligibility period, there are a few more things that we add in. That lead agency has the option to require reporting. Oh, someone just asked me to slow down, so I will take a deep breath and slow down. So the lead agency has the option to require reporting. I'm just that excited to get to the state. So the lead agency does have the option to require reporting if they are choosing to end assistance for job loss or cessation in training or education. So if you are taking up that option, you can require families to report such a change. Families must also be allowed to report changes at any time, and the lead agency has to act on that information if it would be beneficial to the family's amount of child care assistance or co-payment level. So we talked a little bit about it before, about the option to terminate for job loss or cessation of attendance in job training or education program. So the law gave this option to the states, but if the state chooses this option, then they must provide at least 3 months of continued assistance after such a loss or cessation. So things that we clarified in the final rule are that continued assistance must be provided at least the same level. There's no requirement to collect documentation to prove any kind of activity during this time. And if by the end of the 3-month period the parent is again engaged in an eligible work, education, or training activity, assistance cannot be terminated. We also want to make sure that we know that some states use job search as an initial qualifying activity, and we didn't want to accidentally curtail that practice from happening. So we clarify the lead agencies can still do so, but in doing so, they'd have to provide it for at least 3 months before ending assistance. And if during those 3 months the parent does become engaged in a qualifying activity, then they would have to extend the full eligibility period to them. So I'm going to go through a quick explanation of graduated phase-out as we've been presenting, and then we've been working hard on trying to come up with another visually exciting or clear way of presenting the information. So we're going to do the dry text first, and then something that hopefully will provide a little bit more of an interesting perspective that will help you wrap your minds around it. So for graduate phase-out, the law requires lead agencies to have graduate phase-out policies and procedures for families who at redetermination exceed the lead agency's initial income threshold if their income is still below 85% of SMI provided they're also working or attending a job training or education program. And we'd quickly want to note that if the lead agency's initial eligibility threshold is already at 85% of SMI, then they would be exempt from this requirement. So the final rule clarifies a little bit further and says and extends this to say that in order to meet this requirement, you'd have to have two-tiered eligibility with the second tier at either 85% of SMI or an amount lower than 85% for a family of the same size, but, and then we include some language around here to qualify where that second tier has to be. So it has to be above the initial eligibility threshold. It has to account for the typical household budget of a low-income family. It has to provide justification that that second eligibility threshold is sufficient to accommodate increases in family income over time that are typical for low-income workers and that promote and support family economic stability, and reasonably allows the family to continue accessing child care services without unnecessary disruption. So we'll provide additional guidance on how states can report on those factors, but basically ways of trying to make sure that the second tier is sufficiently high enough to still meet the ends of the graduate phase-out requirement. So the implications of this are, there are a few things. Once deemed eligible, a family shall receive the full eligibility period under the same conditions as a typical eligibility period. So that means the full 12 months, and their income can go up to 85% of SMI during the eligibility period. The difference being that the lead agency can now increase co-payments during the year, and in order to increase co-payments, they can also require additional interim reporting. So those are the main differences for families eligible during graduated phase-out. So now we get to the animated part of the presentation. Hopefully this is a flow chart to kind of walk you through graduate phase-out. Hopefully you find it helpful. So if we start with a family coming in at redetermination, we'll go through a couple of the decision points. So besides family income, is a child otherwise eligible? So this is important in that graduate phase-out talks about increasing income levels, but there are a number of other factors that could make the family ineligible. So looking at those other factors at redetermination, if they are not otherwise eligible, then the answer is no, they would be ineligible. If the answer is yes, and they do meet the other eligibility criteria, then the question is the family's income at or below 85% of SMI? So if the answer is no, and their income is above that level, then they're federally ineligible, so then they would no longer be eligible. If their income does fall below that threshold, then the question is the family's income still below the initial income eligibility threshold that the state has set? So if the answer is yes, then they would be eligible, again, for the minimum 12 months. Your income can go up to 85% of SMI, co-payments cannot be raised, and there's limited interim reporting. And this would be for the minimum 12-month eligibility period. If the answer is no, then the question is the family's income below that second tier? And that's either at 85% of SMI or that other level that the state has defined. So if the answer is no, then there's no graduate phase-out required, and the lead agency can consider that family to be ineligible. If the family does fall above that initial income threshold but below that second tier, then they would be eligible via graduate phase-out, which would have the same eligibility conditions as above, except the lead agencies can have flexibility on increasing co-pays and interim reporting. And again, that would be for the full 12 months. Then you come back in the family would come back in at redetermination. So I know there are a lot of nuances that will probably play out, and people still have questions, but hopefully this makes it a little bit more clear. So we're going to quickly say how subsidy eligibility policies apply to tribes. As you know, the rule created 3 tiers of tribes: large, medium, and small allocation tribes. So tribes receiving large allocations are subject to the majority of these requirements. Small allocation tribes are exempt, but the new rule also allows tribes receiving large or medium allocations the option to consider any Indian child eligible, regardless of a family's work, income, training status. If the tribe's medium median income is below 85% of SMI, provided the services still go to those with the highest need. And it also allows tribes with small allocations to have flexibility to set their own eligibility requirements. So now we're going to go to a few Q&As that we've been receiving from states. Just so you know that we have a constant influx of questions that we are dealing with. A lot of the responses have to be cleared through our general counsel. So on our website, we'll have Q&As that we'll post as we get them cleared. So the first question here is, can a lead agency collect information prior to 12 months in order to meet the redetermination timeframe? So yes, in some cases, lead agencies may find it necessary to collect information prior to 12 months in order to complete the redetermination process in time. So such practices are allowed, but should be limited a few days or weeks in advance. And assistance can't be terminated. Even though you can collect information ahead of time, assistance can't be terminated prior to those 12 months unless they're exceeding the federal eligibility criteria. Can a lead agency collect information? Oh, I just answered this. So I was saying that. So as I said, even if information is collected in advance, eligibility cannot be terminated prior to the minimum 12-month period, even if disqualifying information is discovered during the preliminary collection of documentation. So that means unless their income exceeds 85% of SMI, or there's the non-temporary cessation in work or attendance in training or education, you could not terminate assistance prior to 12 months, even if you collected documentation around that. Can a lead agency reduce the authorized amount of service, decrease hours, during the eligibility period? So generally, no. The statute says that eligible families shall receive assistance or receive such assistance for not less than 12 months. And the rule clarifies that that means assistance must be provided at least the same level throughout the eligibility period. However, we'd like to remind you that the state is not obligated to pay for services that are not being used. So if a family voluntarily changes their care arrangement to use less care, then the state can adjust their payments accordingly. If a lead agency chooses to terminate assistance for loss of a job, training, or education, must this apply to all families? So, short answer is no. The lead agency has the option of choosing the option to terminate for all CCDF families or for only a subset of CCDF families, as long as the lead agency provides at least 3 months of continued assistance when terminating. So, what this means is that states may want to say that, okay, for high priority families, even if they lose the job, we're not going to terminate. So you can take a look at your policies on how you want to apply that if you choose that option. Does the family have to provide any supporting documentation during a period of continued assistance? So I mentioned this earlier in the slides. The answer is no. While the lead agency must provide at least 3 months of continued assistance, there is no federal requirement to document that the parent is engaged in a job search or other activity related to resuming attendance in an education or training program during that time. There's no federal requirement on that front. And finally, is there a limit to the number of continued assistance / job search periods? So the answer there is no. The lead agency must offer the minimum 3-month period of continued assistance each time it chooses to terminate assistance prior to the end of the eligibility period for a loss of job, training, or education. So looking at the statute, there's nothing there saying that it can only be applied once. It just has to be applied every time the state chooses to terminate assistance during the eligibility period for those reasons. So I hope, despite the speed with which I went through those, you were able to glean some good information from that. Again, this is going to be made available on the website. So here we include some resources: the CCDF reauthorization page, the technical assistance system, and the National Center on Subsidy Innovation and Accountability. All those will have some resources.
So before we move into our state speakers, we want to, this is Trisha again, we're going to do just a tiny piece of housekeeping. Our second speaker, Erin from Colorado, has joined us. Spoiler alert, Colorado is our second state. And I want to make sure that her audio works because we didn't have a chance to check it before the webinar. Erin, can you hear me? And if so, can we hear you?
This is Erin. Can you hear me?
Yes, we can. Okay, great. Like I said, I figured it was better to check that now when you've got 10 minutes to sort it out. But thank you guys for being patient for that quick 30-second check. So, Min, I'll pass it back to you.
Great, thank you. I'm glad that you could join us, Erin. So first up, we're going to have Terry Shaner-Wade from Pennsylvania and her team come and talk to us about some of the things that they've been doing in their state. So I'm going to hand it over to you, Terry. Thank you again for joining us today.
Thank you, Min. Hello, everybody. This is Terry Shaner-Wade. I work for Pennsylvania. I'm actually the co-administrator for the CCDF program in Pennsylvania. And I would like my team who's in the room with me to join to introduce themselves, starting with Shannon. Please state your name and your job.
Sure. My name is Shannon King, and I'm a policy specialist for Child Care Subsidy.
Thank you, Shannon. Robin?
Okay, Robin Arba. I'm Division Chief for Field Operations.
And Karen Mercadante, I'm the Division Chief for Policy.
Right. And not on the phone with us, not able to join, but certainly a member of this team, two other staff, Jessica Sands and Nancy Buchesky, who also have been actively involved in our regulatory packages that we're going to talk a little bit about. So if I remember correctly, Min, you wanted us to, there were several questions that you shared with us in advance that we'd like to share with everybody. Is that what you want us to do first?
Oh, well, actually, what I think is if you
about our stuff.
If you want to concentrate on what you're doing, then after both states present, we'll have a Q&A and we'll open up to those questions. Okay,
very good. All right, very good. So then I'm actually going to turn this over to my policy chief, Karen Mercadante. We've kind of packaged this two ways. Some of the stuff that we've done already, and then also what we're looking at in response to the final rule, which was issued in September, that would compose our regulatory package. So I'm going to ask Karen to talk a little bit about what we've done already. Karen?
Okay. What we've done already, almost exactly a year ago, December 19th, I believe, marks the date,
right.
We moved to 12-month redeterminations. So we are just now beginning to gather redetermination information for our families, and our first set of redeterminations will start happening come Monday. We have actually a graduated phase-out in Pennsylvania. We have people come in at 200%, but they leave at 235%. So we do have that. As far as where we're going at this point, we did this in a kind of a two-step phase. We started, like I say, last year getting the 12-month RED, and with that we also said that we would opt for the 3-month job search for families that had permanently lost their employment. We are now in the process of drafting regulations. It's a pretty big packet. It's a new packet, in fact, for Pennsylvania because it's that large, the changes are. One of the conclusions that we came to is that we're going to drop the idea of the 3-month job search. We have pretty much fully, I think, embraced the idea of giving the child eligibility for 12 full months despite what might be going on in his family situation. We did this because we looked at it, we instituted it. It has been fraught with challenges and difficulties for our eligibility agencies, and again, with the nature of our families, some of them are bouncing in and out of jobs, and they were trying to track that, and then there was a lot of verifications coming through for this job and then the next job. We started wondering really what the point of all that was, because in fact our families are looking for work the whole time anyway if they've lost a job. So we've dropped that, and we're just going to give the full 12-month eligibility. We actually had a question out there that we asked about co-payments. We asked if we realize that we can't increase co-payments, nor do we during redeterminations in Pennsylvania for the most part anyway. But what we wanted to know is if we could reinstate a co-payment. For instance, a family loses the job, they request a lower copayment, then they get a job. Could those copayments go back up? At this point in time, we've pretty much decided that we are going to request just stabilizing the copayment where it lands. It lands. If it gets lowered, it stays that way until the end of the 12-month period, at which point, we'll do a redetermination and, again, assess it where it needs to be. We have increased our days of absence from 25 days to 40 days. In Pennsylvania, we don't make you ineligible, but what we do is, right now we have 25 days of absence. We have the parent pay for any more absent days. We sort of say we won't pay beyond 25 days. We've upped that to 40 days. However, we also have the ability to suspend care in Pennsylvania, which means that we take the child out of care, but he remains eligible. Parents have that option if a child's going to be absent for us more than 5 days, if he's sick, if he's not going to visit a non-custodial parent, whatever the issue is, we can actually suspend his subsidy, and that doesn't count towards absences. So we're feeling pretty confident that 40 is sounding pretty good in conjunction with the parent's ability to suspend for longer periods of time. We are looking at longer periods of eligibility for children who are in Head Start and Early Head Start. In particular, we're looking to give an Early Head Start child eligibility from when he enters the program until he turns 3, at which point we would redetermine the family, assuming it's been more than 12 months. And then again, establishing the eligibility for the Head Start phase, which would leave him eligible with no further redeterminations until he leaves Head Start and enters kindergarten. In an effort to support quality care for our at-risk children, we have requested that we will not enroll children in facilities that are not meeting our basic licensing requirements. In Pennsylvania, that would mean maybe a facility where we revoke the license or have refused to renew a license due to noncompliance with our certification standards. That's new for us. Again, we're committed to getting children into high-quality care. We have added a piece in an effort to, again, provide continued care for children. One of the bothersome things in Pennsylvania has been in the past that when a child's caretaker leaves the family and a new caretaker steps in, the new caretaker needs to apply, needs to be found eligible, the child goes to the bottom of the waiting list. We don't want that to continue to happen, so we have added a piece that will permit a substitute caretaker to come in when a parent's, under any circumstances, if a parent's deployed, if a parent is incarcerated, maybe goes into rehab or is deceased, we will permit another caretaker to come in and permit the child's eligibility to continue till the end of the eligibility period, at which point then we'd have to reevaluate it. We have a couple deal breakers. The new caretaker could not have income over 85% of the SMI or more than $1 million in assets. We have also added to the packet that 13-year-olds, which currently we end their eligibility on the day they turn 13, we've added a piece that will permit them to continue on with their eligibility until the end of the actual eligibility period for them. On our phase out, we're going to tweak it a little bit. We are thinking that we're going to up it a little. Right now, like I said, you come in at 200 FPIG, you leave at 235. We're thinking that the leaving point will just nudge up to 85% of the state median income. Those are the big ticket items, I believe. Anybody have anything to add? Shanna or
You covered everything that I had listed down.
Wonderful.
Okay.
Okay, thank you, Karen. So, Min, I hope that provides some information for those of you listening. And just to frame that, what Karen just shared, that big list that she just reviewed is part of our regulatory amendment package. It's quite a large one. We hope to publish the proposed regulations, I'll just say in the spring of 2017. It's been quite an undertaking. Karen, Shanna, and two of our other folks have been hard at work at that. So there you have it.
Okay, thank you so much. That's really, really helpful information to have and insights. And I'm sure that we've been getting questions rolling in as you've been presenting. So I'll take a look at those. But in the meantime, thank you. And then we'll move on to Colorado, and then we'll reconvene for questions and answers, or questions at the end. So thank you so much to the entire Pennsylvania team. And hold on while we move on to Colorado. So, 1 second. Erin, are you still with us?
Yep, I'm here.
Okay, so thank you again for joining us, and I'll hand it over to you.
Okay, so I'm Erin Mahwini. I'm the CCDF administrator for the state of Colorado. In the state of Colorado, I'm also a division director over early care and learning, which is in our Office of Early Childhood, as you can see on the slide. The Office of Early Childhood was created about 4 years ago to align our early childhood programs. And so in my division, we have the Subsidy program, CCAP, the Child Care Quality Initiatives program, and the Child Care Licensing program. So it's a nice combination for us, and we are able to align our policies a lot more easily that way. In Colorado, we are lucky that we have a very active advocate community, early childhood advocate community. And so our state advisory council is quite influential. Several philanthropic partners and policy advocacy organizations are active on that as well. And so simultaneous to the CCDF reauthorization in 2014, Colorado was running a House bill. It's House Bill 141317. So for shorthand, I'm going to refer to it as 1317. And essentially, the bill was packaged as a bill that would help with the improvement of early childhood education for children in Colorado, leading to better school readiness and two-generation outcomes. And that is exactly how we promoted it. It was the way that we engaged stakeholders, parents, counties. We are a county-administered state, and legislators. And so up front, we did a lot of stakeholder engagement to get buy-in to these changes. And it just so happens that 1317 aligned very closely to the CCDF reauthorization. So we have clairvoyant people here in Colorado. I was not one of them. I was not on the team at that point in time, but they knew where the kind of the direction that things were going, or at least sensed it, and they felt like it was a good thing for children. So 1317 established a higher entry-level floor for families. We used to require that families be served if they were under 130% federal poverty level. We raised that to 165%, and then we added a graduated phase-out exit, essentially an exit income level of 185% or higher. And so if counties do not have, if counties are serving families lower than 185% federal poverty level, they had to have that graduated phase-out exit income level. We'll be adjusting that a little bit now with the new federal rule. We also introduced tiered reimbursement for providers based on quality ratings. And so that meant we had to have a statewide quality rating system. We were able to do that with the help of some Race to the Top Early Learning Challenge grant funds. But essentially now any provider who has a high quality rating gets a higher reimbursement payment, and that is to support the quality that they're quality care that they're providing. We also introduced a reduced parent copay. So in Colorado, parents don't pay the difference between the subsidy rate and the private rate. They actually just pay a copay based on their income. And so if they choose a high quality provider, then those parents are getting a 20% discount on their parental copay. House Bill 1317 also extended job search to 60 days. We then in rule changed that to 90 days so that we're in alignment with federal law. And we also extended benefits to students so that they can be in either a 2 or 4 year education program, and we leave it up to the counties to determine how long they'll honor that, but those are extended education time limits for the state. We also strengthened our language around decoupling of schedules so that, again, phrasing it or putting it in the terms of continuity of care for the child, and also ensuring that that child's education needs are being met. We wanted to make sure that parents, even if they're working nights or weekends, are able to enroll their children in quality care during the week, during the day. And so, as you can see, 1317 really did kind of lay the groundwork for us, but after the legislation was passed, we had a lot of policy and rules and kind of how much are those tiered reimbursement rates going to be, how much of a percentage are we going to give to parents for choosing high quality. Those kinds of nitty-gritty details were hammered out through a joint task force. The joint task force was made up of county officials, because they're the ones administering the subsidy program, early childhood advocates, and providers, as well as my department, representatives from my department. And we spent a year and a half hammering out how we were going to implement all of these major changes to the program. I will say that what helped us the most is that we used a lot of data. We looked at a cost modeling tool, the PCQC, in order to help us set our tiered rates based on something more than just the market rate survey. We wanted to be able to tie tiers to the actual cost of quality. And in Colorado, we identified that the major cost drivers are personnel costs, and then property costs. So those two things were plugged into the model, and that is actually how we were able to establish our tiered rates. We actually did find, and I'm a big advocate now of using some sort of cost modeling, because what we did find is that we were inadvertently incentivizing low quality providers, and in Colorado a low quality provider is a provider that is licensed, and that is it. And so low quality providers were actually able to be somewhat profitable even at a low CCAP reimbursement rate, but as soon as they started to go after quality at a level 2 through 5, they started to go into the red, to the point where our level 5 providers could feasibly be in the red at about $220,000. That was our model facility. And so what that told us is that we didn't want to pay the 75th percentile to low quality providers. We wanted to be able to pay the 75th percentile of the market rate to the highest quality providers, so that we weren't creating a perverse incentive for providers to stay at low quality. And then what happens is all of our subsidized kids end up in low quality care. We also track every month how many providers are improving their quality that accept subsidy, and we have certain goals around that. So right now, last year's goal was to get up to 39% of all kids receiving subsidy in some sort of high quality provider. We met that goal and have exceeded it. We're now at about 45% of all providers are high quality that accept CCAP subsidy. And now we're also working on geographic dispersion to ensure that we actually have high quality providers throughout the state, because we are a fairly large state and have a lot of geographic diversity as well. And so we want to make sure that parents have geographic access to high quality as well. So we track that on a monthly basis as well. And so that's something else I think that Colorado has as a lesson learned, is that the more data we have, the more we're able to show that these types of policies and legislation really work. They work in a positive way for families. They work in a positive way for kids. And we have the data to kind of show those trends. So I think I'll leave it with that and see if people have any questions.
Okay, thank you so much, Erin. And so now I think we'll move to the question and answer portion. I know that there's a lot of helpful information for states to take in. I also want to be aware, I know, Erin, you have to jump off a little bit early. So in case you have to jump off, I wanted to give you a big thank you for joining us and for sharing all that information about the work you've been doing. Since you have to leave early, I'll throw the first question out to you. I know that something we discussed a lot at SAM and other meetings is that with reauthorization and the new rule, particularly 12-month eligibility and the emphasis on continuity of care, a lot of states have talked to us about the need for a culture shift regarding how caseworkers and staff approach the program. So I want to ask you, Erin, have you encountered this? And if so, can you just discuss some of your experience or any possible strategies you've used for handling such a shift?
Yes, most definitely we've experienced a culture shift. And I think the added complication for Colorado is we are county administered. So we have to rely on our counties to buy into what we're trying to do, because they can opt out a lot of the things that the state recommends, including our state recommended rates. And so I would say that the House Bill Task Force was a good first step in trying to get the word out to counties that there was a kind of a culture shift happening, at least in Colorado, and then as reauthorization happened at the federal level. We have implemented annual CCAP conferences now, so we meet for 3 days. This last year, we actually included child care licensing to kind of help educate our county workers, caseworkers, around more than just their program, but to actually understand how licensing and quality ratings work as well. So we've kind of engaged them actually in person. We have multiple trainings that go on throughout the state through our fantastic training staff, Subsidy training staff. And then we also just recently, we of course did all of the public hearings we needed to do when we were vetting our CCDF state plan, but we actually have continued to do a similar model. We just had 3 stakeholder meetings over the last 6 months, or actually about 4 months, to talk about the future of CCAP program and what more we need to do to incentivize providers to actually accept the subsidy, as well as what are some of the additional pain points that both counties as the administrators and families are facing, and how can we continue to improve the program. So I feel like these ongoing conversations are the only way we're going to get people past the culture shock. I think in particular the 12-month eligibility is a hard one for counties to swallow. It's more expensive for them, obviously, and in little towns, people know people's business, and so in Colorado, you are not allowed to act on information that would put a family at a disadvantage. So if you know someone got a raise or got a promotion within that 12 months, you're not allowed to go in and adjust their parent copay based on the new income until the 12-month redetermination. And so when you live in a small town, a rural town, this kind of information could be known even though it's not being reported. And so it's those kinds of culture shifts that we're addressing kind of on an ongoing basis.
Okay, thank you. That's very helpful. I'll throw the same question out to Terry and her team. Is this something that you've seen or no?
Yeah, and I'll start this, and I'm going to ask Karen to pick it up. Yes, we've definitely seen an adjustment curve on the part of our eligibility agents in accepting the 12-month eligibility and a reduced list of reporting changes. Karen, I don't know if you wanted to elaborate on some of that.
I think that the first hurdle we had in a culture change was right here in this office.
Yeah.
And I think we're living proof that it takes a while to like fully, I think, embrace this. That's why we ended up taking the 3-month job search, thinking, well, you know, we really want to make sure people are working and that we're getting this to working parents. And here we are a year later saying, you know what, it really, that doesn't net us a very big difference, really. And in fact, it causes us a lot more work to try to track that stuff than it does just to say the child has the eligibility and trust that parents need the care because they're working. And I do believe that that's true of most parents. So first we had to get over our own difficulties with it. I think we're in pretty good shape now. Our eligibility agencies are trying very hard. Some of it is not foreign to them, the not raising copays, some of the reporting requirements, that's not new for them. But providing care for parents that aren't currently employed is a little more difficult for them. We had numbers of timelines, so much for maternity leave, so much for disability, you know, and you had to be back at work. Letting go of all those timelines is a little bit difficult for them, and they're struggling a bit. And then I feel for you because we've gotten a couple hundred questions from them on this.
And this is Terry. Just one piece to add to that, that kind of makes the adjustment a little harder. I don't know what it's like in Colorado, Aaron, but with the fact that we're trying to improve and provide seamless experiences for the children in quality care, you know, for the minimum of 12 months, we have 9,300 children right now waiting at the door for funding. So given that dynamic and that reality, you know, it's trying to achieve that balance, if you will, you know, in trying to provide the seamless quality experience for the child, but knowing that we don't have enough funds to meet the demand.
Yeah, Colorado, luckily Colorado doesn't have quite that large of a wait list yet. I mean, we certainly have seen a growing wait list, and more and more counties are becoming nervous about having a wait list. You know, in our state, counties can change certain things. They can change eligibility levels as long as they don't go below 165% FPL, and so that's a way for them to what I call mask a wait list at the county level. But we do hear those kinds of pains, definitely, and the counties don't want to turn anyone away, and they also have a really hard time turning away a family who they know has a much lower income than some of the families already in the program. So that 12-month eligibility is another pain point along those lines as well.
Well, thank you. Yeah, I know that there's a lot of change at all levels to be made, so I really appreciate the work that you're doing on that front. Aaron, I know you have to jump off soon, so can I throw you one more question before you leave?
Yes.
Okay. So you talked a little bit about the need to engage different stakeholders as you're rolling out with all these changes. Are there key entities with whom you've engaged, or any stakeholders that were somewhat surprisingly effective as you're doing this?
So I would say a couple of key organizations for us. We have a fairly powerful organization called the Colorado Children's Campaign. They are looked upon as the sort of state expert when it comes to the state of Colorado's children. So for, boy, almost 2 decades now, they have put out a statistical report on the status of kids in Colorado. And so they always have a lot of powerful data to back up the legislation that they're sponsoring or helping sponsor. And so they're probably one of our most powerful allies because they're seen, you know, as an independent nonprofit organization, and it's very well respected. We also made sure that we had our Head Start grantee organizations working with us, just because we want their buy-in, and also they're good kind of providers on the ground for us. Again, I think because we are county administered and we kind of have to get buy-in on all of our policies and our rules at a local level, it's ingrained in us that we involve our county partners, our local partners all the time. But I feel like that's, you know, wouldn't hurt any state to do that. And then we actually did engage our unlicensed or an exempt provider network. So we have an organization called Padres Unidos, and they are a big advocate of family, friend, and neighbor care, and not always on the same side of us when it comes to who should be licensed and how they should be licensed. But in the case of House Bill 1317, they understood that there was some real positive changes that would be made for families that are low income, and so we partnered with them. I would say that's probably, you know, if you're thinking strange bedfellows, that's one that, you know, we broadened our network to make sure that we were including those groups as well.
Okay, thank you so much. And I think we have time for one more question for Pennsylvania. So there are a couple of questions around the job search change that you mentioned. You said that after seeing the administrative burden on the terminating and having a job search policy, you decided to forego that in order to offer a full 12 months for families, even if they have that change. Once they want to know if you've seen a fiscal impact around that policy change yet.
So this is Terry. So when we made the decision to go around with the 12 months and 90-day job search options, with the job search option, we did some analyses. And really, the net effect of any change that we look at that would improve and grow opportunity for children to participate in a program, really the net effect of that is our wait list, growth on our wait list. That if we set up criteria that would limit the circumstances of a child leaving the program, that means entry through the front door slows down. And when we did our initial analyses, not so much from a fiscal perspective, but from a wait list growth perspective, we actually anticipated that our wait list would grow into the 5-digit area, approaching 20,000 during years 1 and 2 of implementation of the 12-month eligibility period, even with the 90-day job search. We opted for the 90-day job search because we thought that was one of the few things, perhaps the only thing afforded in the federal language that could help limit significant impact on the wait list. I'm happy to report, even with having a wait list at present of 9,300, that reality or that prediction has not come true. We have not hit 10,000. And we think we're at a point, as Karen pointed out, we are at the cusp of the first set of families reaching that 12-month benchmark. And if we were going to hit a 5-figure wait list, we're pretty sure it would have occurred by now. Having said that, with all the other things that you heard Karen share about what we're looking at as far as further improving and facilitating a child's continuous uninterrupted care experience, we know that those changes, either in part or in whole, will have similar effects on our waiting list. And that the bottom line will be we will not be able to serve as many children as we have in the past under prior rules. So really what it comes down to for us is what will be the impact on the wait list, what will be the growth. To package it another way, at the beginning of this fiscal year in July, on average, we maintain basically at county levels county waiting list, but then we also have a statewide look at that. And we manage and shift dollars where we see inequities in wait lists across the state. At the beginning of the fiscal year, at any one time, the average duration of a child on the waiting list was about 60 days. We are now at 99 days for, as a statewide average for duration on the wait list. So we know that those are the numbers that we're going to need to look at as we look at these proposed changes in our regulatory amendments.
Okay.
So,
thank you so.
Yep.
Yeah, no, I want to be cognizant of people's time because we are up against the 4 o'clock. Judging by the questions that are coming in, we could have gone for another 15, 20 minutes. But we'll wrap up. And thank you again to both Pennsylvania and Colorado, if you're still there, for joining us and answering these questions. I'll share the questions with you also that you can see what your colleagues have been. Well, I'll share them anonymously, but you can see what questions have been generated by your presentation. But I found it very informative, and I hope everyone listening also found it informative. So we'll be having the next webinar on January 12th at the same time. We bumped it up by a week because of inauguration, but the next one will be on consumer education and quality. So we hope you'll join us then. And thanks again to all our presenters. Again, this will be put on the web once we've made it compliant. And I hope you all enjoy the rest of your afternoon. Tricia, is there anything we need to wrap up?
No, we did. There were a lot of questions for both Colorado and Pennsylvania that we didn't get to, so we may talk with some of our TA partners about seeing if they can help us get some answers to those questions without increasing the burden too much on Pennsylvania and Colorado, the teams there.
So, okay, thank you again to everyone, and enjoy the rest of your day.